We now moving on to our next session. We were hoping to have a commissioner with us, Maria Gabriel. Unfortunately, she can't be with us, but I'm just being told that she is being replaced by a cabinet expert on health, Laso Ballesteros. Are you there? He's still trying to find his positioning, I think. Is your camera and microphone on?
Yeah, I see it's on. Can you hear me well?
Yes, we can hear you. Thank you very much indeed for standing in at the last moment. I'm not terribly sure why the Commissioner couldn't join us, but we're very glad that you are able to be here.
You know that she has tested positive on COVID, so...
Oh. No, I didn't realize that. But, okay. Well, we wish her wish her well.
I will try my best. I will not be able to replace her, of course, but I will follow the answers that we have prepared together with her.
Well, I'm sure that you will do very well, because I mean, obviously, what we wanted to ask the Commissioner was that, you know, because health is top of the political agenda, we want to know how it is actually going to change research policy priorities, if you like, research priorities, because as we're hearing from so many of our speakers, all of a sudden the focus has changed. So what would you say to that then?
So yeah, so first of all, this is not new. Health is a top priority for research, has been before and is still like that. As the President von der Leyen put in the State of the Union speech, the virus has tested our healthcare system, but also our societies and economies, and showed that we need to build what is called a European Health Union. And in our view, the Commissioners and the Services view, research and innovation will underpin this European Health Union. I see that this is completely aligned with the key recommendations that you have presented to us, and this is and in this sense we are fully aligned. So you also know that from the beginning of the pandemic, in January already we started launching 18 Horizon 2020 projects. So this shows how we were ready for that. So you also know very well the projects funded. The 166 projects supported through the European Innovation Council, and in particular the specific call in May with 148 million for 36 companies. So you see, this is quite a lot of things that have been happening already and will be happening in the future. We will have the next generation EU on these lines as well, supporting the future research and innovation, in particular in the area related to COVID and including, of course, health, with a 5 billion euros extra funding on that.
But I mean, you're talking about the money that's available, but there must be a lot of disappointment, though, that there isn't as much as available as had been hoped for Horizon Europe, and that must be very disappointing, and that will have some impact, one assumes.
Well, you have to realize that this is a significant increase in comparison to Horizon 2020. So we should never forget this, and this is a 20-something%, so it's a huge increase. Like no other area in the budget of the Commission has increased as research and innovation, so we wanted more, of course. You all know our initial request, but we have to be very, very pleased with the final result in comparison to the past. If you compare to what we wanted, our expectations, no, but if you compare to the actual figures and data of what we had before, this is a big increase. And it's a big increase that, as you know, is a lot of that is going to go into the area of health, not only because of COVID, but as well, but also because we have realized that we need to increase our capacity to deal with future pandemics in this area. So this is...
Sorry to interrupt, but where do you see the gaps then? I mean, what sort of lessons do you learn from COVID? Where do you think there needs to be more research and innovation if you are going to go more down the health road?
So I think this is very important to when we are talking about research and innovation, and in particular in the area of innovation, to think on synergies with other programs. So with other programs that are closer to the end users, so that we complement the strong work and leading work that we are doing in Europe in the area of research with the capacity to implement those in the health systems in Europe. And for that, I think for the future next multi-annual financial framework, to work on synergy between the research and innovation program and the cohesion funds is going to be key. Actually, you know well that for many countries in Europe, in particular Central Eastern Europe countries and some countries who are not so advanced in terms of innovation, cohesion funds is the main source of research and innovation. So that's why we need to start working on both things together, so that we are addressing the different challenges that we have challenges related of lack of sufficient amount of startups in the area of innovation on health. We have, of course, issues still related to vaccines, as you know, in the area of COVID and the capacity to develop quick vaccines in compliance with all the regulation. So there's a lot of work to do in the future, but we should not forget that we're starting already from a very good point.
And how do you see the public-private partnerships growing and expanding in the future? What more needs to be done in partnership with the private sector?
So in the area of partnership, we have already, as you know, we have presented a series of partnerships for the future. There's a lot of them. I think we should be aware that for the first time we are launching the partnership, bringing together all the different sectors of the medical area of the health sector. This is a big novelty in comparison to the past, that we should continue working on that. On top of the partnerships between research and industry and with the Commission, we should also think on the new missions as a way, and in particular the cancer mission, where we are going to bring not only industry and researchers and the Commission, but we are also going to bring the civil society and the other public authorities across Europe. So I think the missions is a new way of working that we should certainly scale up, and that we should be continue in addition to the partnerships that I was checking yesterday. There are like 6 or 7 partnerships in the area of health. That's important. The partnerships with industry, the partnerships with the member states, but also the missions in bringing together all the players, all the stakeholders of the research and innovation ecosystem.
And what about the people part of this, so the researchers, the training of researchers, making Europe a really attractive place where people want to work? We hold on to our talent and our creative minds. Can more be done? Because the EU Health Coalition, is asking for greater harmonization of training programs, for instance, just to do more to keep people here and to make people want to work in Europe.
Yeah, well, here I think, that for the Commissioner, Gabriel, talent is one of the key priorities for the future. And she welcomes very much the latest Council decision where 200 million have been moved to the Marie Skłodowska-Curie actions. I think that's a good signal from the member states that they realize the importance of having more researchers in the area of health in particular. We in the area of the European Institute of Innovation and Technology, that is also under the leadership of the Commissioner Gabriel, you need to be aware of the excellent work that they are doing on bringing together the universities closer to the innovation ecosystems. That's also something we need to praise. And the new era for you. Helping the careers for our researchers is also something very concrete that we need to follow up, and we hope we will provide the resources to help to have the adequate talent in Europe, because we all know that the key is not the capital, is not the money, is not even the technology. The key is the talent, the people. And here in Europe we are very well there, but we need to be even better. That's why the area for you, the EIT Health, and the Marie Curie extra money will be very useful on this.
But on the other hand, you see things like Erasmus Plus programs with budgets cut, so it seems that there's money on one side and money being taken away elsewhere.
Yeah, well, this was very unfortunate that we were not able to get money in both sides, but we need this. Otherwise, you can see the glass empty, half empty or half full. I think we need to be positive in the sense also for this extra money for the Marie Curie, for the researchers in particular, not for the Erasmus, but for the researchers. Yeah.
What is obviously really key for the future of managing pandemics and health issues generally is data. And we've talked already about the European health data space, the need to really create something that works in this field. I mean, the European Centre for Disease Control, we're going to hear from the head of the ECDC in a moment, but I mean, she's talked about the fact that they didn't have the data that they needed, and it is really important, isn't it? So where do you see the challenges in creating a European health data space, and is it going to happen?
Yeah, well, the COVID-19 pandemic has demonstrated the importance of the early sharing of results and global collaboration, and of course, always around data. A good example of health data exchange to support research is the establishment and the development of the European COVID-19 data platform that you know. We are very pleased of the results since it was launched only in 20 April 2020, to a very few months ago. It has already received more than 2.7 million requests for data, so it's a huge demand for the data from 80,000 different users in 170 different countries. So importantly, the European COVID data platform demonstrates how rapid data sharing can accelerate scientific discoveries and innovation for the benefits of society. So we can see this is how this data is important to share for research in health, how there is a huge demand, and how the Commission is working on contributing with these platforms for sharing data. We are still in the initial stages of development of the European health data space, collecting input from all the relevant stakeholders. I can assure you that the work will continue in the future, including the governance framework for the secure and also taking into account data privacy for the health data, improving the data interoperability and the quality of the infrastructure deployment. These are all critical aspects for the success of the data platform, which, from what I could see, were widely covered in the EU Health Coalition, the recommendations on the European health data space and interoperability. We are fully aligned here, and we have the intention to continue working on this European health data space. And as I mentioned, this COVID data platform is something concrete that we have done that has helped us to test the concept and even the technology, and has got a lot of requests and has become already a big success. So this will be very important push for getting the European health space.
Now, just finally, I was going to ask the Commissioner, and I don't know if you can answer this on her behalf, but I was going to ask really what the one priority, looking at the Health Coalition recommendations, which would be the most important recommendation or the priority one in research and innovation from her perspective. I don't know whether you were able to find that out from her or you could answer that question.
So we were talking about that, and in particular the recommendation you have for this EU multi-stakeholder forum for better access to health innovation. I think that everything that has to do in bringing together stakeholders is important. We are already working on that, as you know. So we invite you to be part of the co-design process that we are doing. And as you know, the co-design process for Horizon Europe is not starting and finishing when the Horizon Europe starts early next year. The idea is that we'll continue as a way to consult with all the stakeholders. So I think this certainly is one of the recommendations that has raised more attention to us. Of course, that data space is essential, and we have already been talking, but certainly we were talking also about this idea of the innovation ecosystem that you were talking, and the innovation hubs. So there are many recommendations in your list that are really fully aligned with our way of thinking at this moment.
Well, that's good to hear, and thank you so much for stepping in at the last moment, because I mean, we ask a lot of you to do that, so thank you very much indeed. And in fact, our graphic recorder has also been hard at work, Christopher, and we'd love to hear from you again or see what you've been doing, Christopher. If you'd like to show us your drawings. I mean, I know that it's, again, it's a lot to ask you to do in such a short time, and it's been quite a far-ranging discussion, but maybe we could have a look at Christopher's. How did you get on? It's all very fast-moving, isn't it? You're doing a great job.
Try my best. I'm sure I missed a few things.
We can always add later on.
Absolutely.
Yeah. I mean, I'm sure you have to do that anyway, because you can't do it all at once. But to create synergies with other research, and that was a point that was made very early on in the there it is. All stakeholders to be part of the co-design process, data sharing, talent is a health priority, and to continue to scale up public and private partnerships. So there we are. We even get our lovely little sketch and outline of our speaker. So thank you so much, Chris. It's really fantastic, and thank you for being with us. And we'll see your. Have you seen it, by the way, Isidro?
Yeah, I was watching. I have already muted myself, but yeah, very good, Christopher. Very well covered.
You can put that on.
Capacity to synthesize in such a short period of time.
It's a real talent, isn't it? It's a real talent.
Indeed.
We will send a copy of this to you, of course. And as I can see, you're in your kid's bedroom, so you can always put it on the wall there. Well, thank you so much to you both, and the best to the Commissioner, of course. We send our very best wishes.
I will.
Thank you.
Thank you.